actually. I had a patient who I see pretty regularly for counseling, and she recently became pregnant about 4 to 6 weeks ago. And on a previous PHQ-9 depression screening, she scored maybe a 14, 15 in that range. And so our practice considers her a high-risk pregnancy. And so she can no longer obtain OB services here. She's been referred to Mount Sinai OB.
Just because of her depression.
Because of a depression, any depression rating. There's a fear of a depression score and what that means, or when a patient expresses suicidal ideation. There's definitely an automatic hands off. I can't even go further with this patient. Please see them, or refer them out, or just a hands off.
A fear.
Approach.
So even when you have a psychiatrist and mental health clinicians and we've stabilized them, they still don't want to take them back even after they're stable, which is a problem. So
right.
The
and
barrier
really,
is...
A score on a PHQ-9 could be a momentary experience.
Absolutely.
We all go through feeling sad or down or depressed, and who knows what her momentary state was, and is that significant enough to deny her of long-term services to care, which is what the collaborative model ultimately is for, is to prevent long-term hospital stays, to prevent hospitalizations, to prevent ER visits, and to maintain a comprehensive care in a primary care setting.
Right.
Understanding the importance of mental health care is a first step. Understanding the importance of assigning funds to our mental health care, to incorporating it into the primary care process, to destigmatize mental health care in general. A lot of patients come in already feeling stigmatized. If they even mention anything around mental health care, they associate labels with long-term diagnoses instead of temporary, potentially addressable barriers that can be overcome. And I think there's a fear too of some of our providers that a label is long-standing. And if somebody is a substance user, they're always a substance user. If somebody's depressed, they're always depressed. Instead of looking at it as a treatable symptom the way we would a medical diagnosis. For our providers, they would have that same kind of confidence, but even more so if you're here because out of sight, out of mind.
Right.
And the additional time that it takes to collaborate,
to call
with somebody
right.
who's off site is a barrier in itself. It's a work in
Even
progress.